Today, we're going to talk about stress and the impact it has on your system. And we're going to give you some suggestions on the best ways, or some ideas at least, on how you can help your body compensate for that added burden on your system. So, have you ever really wondered why you get those butterflies in your stomach before or doing something stressful? Our stomach can feel like it gets tied in knots after an argument, but why is that? Or have you ever had a meeting with the toilet that went longer than expected and it wasn't caused by something you ate? Stomach problems are one of the most common symptoms of stress and anxiety. Our bodies are well equipped to handle stress in small doses, but when that stress becomes long-term or chronic, it can have serious impacts on your body. So when the stress you're under is greater than your body is able to tolerate, you are at risk of a stress-related disorder. Stress can make you sick. Our goal is to talk about how we can keep that from happening. The negative impacts that stress can have on your memory, your thyroid function, even your blood sugar issues, it can wreak havoc in your whole body. It can even decrease your muscle tissue or your muscle mass. It disables your immune system, so you can quite possibly have a big bullseye on your back for germs from the environment. You don't sleep right, you don't eat right, you don't relax right, and you think you're cruising through life until your body says enough. Insomnia, anxiety, depression, illnesses, heart problems, autoimmune issues, even worse. Each of these illnesses has its own problems, and when you put it all together, you're on this merry-go-round, and getting off of that merry-go-round isn't easy. So make no mistake, stress can kill. Is stress an issue for you? Chronic stress is different from the flight or fright syndrome, that people can experience with that adrenaline surge and that rush. Chronic stress changes actually the way your body functions, so it feels like it's constantly under stress. So what happens in that state? Normally, when you have this fight or flight, you have a surge of adrenaline. It causes your heart to pound and race. But chronic stress actually has a consistent release of cortisol and higher levels of adrenaline. It makes you more susceptible to heart disease. Your brain functions compromised, learning and memory are affected, and even how your brain just inputs those long-term memory moments. The immune system, which constantly suffering from an onslaught of these hormones, gets suppressed. It's overworked and it doesn't respond well. So cortisol is your main stress hormone, and that's produced in the adrenal gland. It regulates blood pressure and blood sugar, immune function, and inflammation. In small amounts, it's actually really wonderful. It can help improve your memory, lower your sensitivity to pain, and even give you energy. But to turn it off, your body has to go into this relaxation response. There's a switch that actually has to happen. If that doesn't happen, the switch to the relaxation response, your body doesn't have an opportunity to return to normal. So you're going to hear us talk a lot more about returning to normal, as it's imperative that that happens for repair and healing in your body. What are some warning signs of stress? Dizziness, aches and pains, teeth or jaw issues, headaches, of course, muscle tension. We hear a lot about problems sleeping, heart racing. You can see the list. There's so many different ways that your body will experience physical symptoms of stress. So how are the different ways that stress affects the body? Again, it goes through so many different systems, and we're going to dive into that a little bit deeper. First, let's talk about the cardiovascular system. So heart and blood vessels, acute and chronic stress with inflammation, and pre- and postmenopausal differences. Acute stress we talked about a little bit with the increase in blood pressure. You're at a much higher rate of heart attack for people who have who are constantly activating this short-term effect or this fight or flight response. So whether it's slamming on the brakes in traffic to avoid an accident, or maybe just getting this immediate response that you missed a meeting, those panic type situations will activate the acute stress response. Blood vessels can expand and contract, and they do this differently depending on the adrenaline response. So when we know that the blood vessels tighten up, that raises your blood pressure. This is the fight or flight response. Once the acute phase is passed, you typically go into relaxation. Now, chronically, we know that stress can lead to long-term heart problems like high blood pressure, heart attack, and strokes. It also attributes to inflammation of the blood vessels. And what does that lead to? Well, heart disease. How about cholesterol? Yep, that worsens as well. The risk for heart disease associated with stress appears to actually be different for women especially if that person is a pre or postmenopausal female. Estrogen in the premenopausal woman actually seems to help the blood vessels respond better during stress. Postmenopausal women, however, they lose this level of protection when they lose the estrogen. Therefore, they're actually at a much higher risk of the effects of stress and heart disease. Let's talk about the nervous system next, because gosh, so many people struggle with concentration and memory. There's two parts of the nervous system that play a role in stress. There's the fight or flight activator, which is called the sympathetic nervous system. And then we have the calming, heal, and repair system. That's called the parasympathetic nervous system. So sympathetic nervous system and parasympathetic nervous system. Fight or flight, calm and repair. Sympathetic nervous system kicks in really quickly. I think we're all familiar with how this works. The parasympathetic system, again, relaxation, repair and heal. Chronic stress actually results in a long-term drain on the body. It's continuously stimulating the sympathetic nervous system. And the problem is your parasympathetic nervous system doesn't stand a chance when it's being overridden by this fight or flight all the time. So our job is to try to find ways to strengthen the parasympathetic nervous system that repair and heal. If we don't, there's a significant number of diseases that are strongly correlated to what's called sympathetic overdrive, fight or flight all the time. Those diseases are not limited to, but include things like dementia, where you actually have shrinking of the brain tissue. Alzheimer's disease, we know this is much higher in post-traumatic stress patients, and we know that injury is emotional and not always physical. Parkinson's disease, where we have damage to the dopamine-releasing neurons, and of course, multiple sclerosis. We know that new lesions can predictably appear 4 to 8 weeks after a stressful experience. Let's move on to the endocrine system. Endocrine system means your hormones. So we're going to specifically talk about the HPA axis, which is how the brain and the pituitary and the adrenal glands talk together. You don't have to remember all those terms, but just know that your body is very interconnected and systems are talking all of the time. There's a really amazing communication network happening behind the scenes at all times. So during stress, the brain produces a series of hormones, and those signal the adrenal glands to release cortisol. So remember, cortisol is your stress hormone. In short-term situations, the body does exactly what it's supposed to in this response. While it's valuable that we can have cortisol release, chronic stress and long-term cortisol release actually causes a miscommunication between the immune system and this whole brain, pituitary, and adrenal gland, also called the HPA axis. Well, now when you have communication systems running amok, it wreaks havoc in your system. It's linked to numerous physical and mental health conditions, including chronic fatigue, diabetes, obesity, hypercholesterolemia, depression, and all sorts of immune disorders, all because of the lack of communication. You know, when you think about this, it's sort of like when you're sitting in that circle as kids and you have the cup up to your ear with a string and you whisper into it, or if you whisper to the next person beside you, the message when it gets back to you, because it's not a clear means of communication, is definitely different than what was intended. And we see that happen in the body with the endocrine system when things run amok. How about the musculoskeletal system? Millions of people suffer from chronic pain conditions. Often, but not always, there may be injury that sets off this chronic painful state. If there's not an injury, or whether someone does or doesn't have the injury, they can actually suffer from chronic pain, and it's how the body's actually responding to that energy. Individuals who are fearful of pain and re-injury almost always have a worse recovery than those who maintain a certain level of moderate activity. Muscle tension, especially long-term, can lead to muscle atrophy because people are hesitant to use those muscle groups. These all promote chronic stress-related musculoskeletal issues. So relaxation techniques and other stress-relieving activities are highly effective in reducing muscle tension. They can reduce the incidence of certain stress-related problems like headaches, and easily they can increase your sense of well-being. How about gastrointestinal tract? This is a super common one for all of us to see. It can make pain, bloating, and bowel pain worse. It can cause diarrhea. It can cause constipation. Stress can induce all kinds of muscle spasms and cramps in the bowels. It absolutely affects digestion and what nutrients you get absorbed into your system. We have gas production, which increases. We have intestinal barrier issues that develop, or the leaky gut type pattern that allows different gut toxins to enter the body. Almost all of these bacteria and toxins are easily taken care of by the immune system and don't make us sick unless someone has a leaky type of gut, and then we have a chronic low-grade inflammatory response. We see a lot of stress affecting chronic bowel disorders like irritable bowel, ulcerative colitis, or Crohn's disease. So this may be due to the gut nerves being more sensitive, or it could be the change in the bacteria of the gut, as study after study shows us how much stress changes those bacteria that live there. And it can even be a hyperimmune response of your gut to your immune system. Lots of common stress-related gut issues, as you'll see in the list here, with indigestion and stomach cramps, diarrhea, constipation, people who are either unnaturally hungry or have no appetite. The resulting chemical imbalance that can occur from stress-related gut issues is definitely very troubling. And remember, the gut communicates with the brain and the brain communicates with the gut. So if your gut is a mess, you can believe it's sending those types of signals back to the brain and vice versa. You know, the brain is incredibly powerful, but the gut has its own nervous system called the enteric nervous system. It's completely housed all on its own. It can function all by itself. There's actually more nerves in the gut than there is in the spinal cord, which is so impressive. And it communicates with the rest of the body, but again, especially with the brain. So we call that the gut-brain axis. And if the brain is unhappy, the gut will be unhappy. If the gut is unhappy, the brain will definitely be unhappy. So let's talk about some tips for reducing stress. You know, stress creates all sorts of health issues, as you've seen in our discussion. We know that it can cause high blood pressure, increase your risk of heart attacks, causes fatigue and headache, loss of motivation and anger and depression issues. So what can you do to help reduce the stress? We're going to talk about 7 important tips. So the first one we're going to do, breathe deeply. Just breathe in through your nose and out through your mouth. That simple step of breathing very, very deeply is actually something that is the most powerful thing to stimulate our calming system. The next thing that I want you to do is I want you to become very aware of where you feel stress. You can't change what you don't notice. So be aware of how it feels in your body. The next one we're going to talk about is label your stress. Give a voice to what you feel. So, you know, if you're feeling angry, go ahead and just let yourself be aware of that. I'm feeling very angry, or I'm feeling very frustrated. When people say, I'm so stressed out, it actually creates worsening symptoms. But if they say, I'm frustrated with the kids' return to school plan, or I'm irritated, I have to wear a mask, or someone can say, I feel so out of touch that I haven't been able to get back into the gym. Whatever it is, put a label to it. It's amazing what that actually will tell your brain. The next thing is I want you to do some cardio exercise. We always say at Vitality, move until your mind is clear. It's going to help your brain release those really good feel-good chemicals, and that can help ease depressive feelings and anxiousness. It doesn't have to be training to run a marathon. Literally move until your mind is clear. Now we know that the more we can do a cardio type of program to get your heart rate up for at least 20 minutes, we actually can release a ton of endorphins, or those feel-good hormones. So there is some benefit by pushing it a little bit, but as long as you're moving and allowing your mind to clear, that's doing you a ton of good. The next one is control what you can. So taking action is very empowering. And again, those little small steps that you can do, try to reduce the major stressors to components that you can make decisions on and act on. And the last one I want to stress is called learning how to meditate. This can help reduce anxiety. It will absolutely improve your focus and also help you have better concentration. We're going to put a PDF of these 7 tips in your documents so you can easily pull those out. I would love it if you printed those out, put them somewhere where you'll see them every day, and continue to focus on those simple behaviors that can really help your body handle stress so that we reduce the impact it's having on you. The next thing we're going to talk about is box breathing. This is another crazy strong thing that can actually settle your system. And that's what we want, because remember, the more you're in fight or flight, the less repair and healing ability your body has. So box breathing is one of our most powerful techniques. What I want you to do is I want you to find a comfortable position to sit in. And I want you to take a nice deep breath in and blow it all the way out through your mouth, nice and slowly, so you just really feel like you've emptied everything out. And then what I want you to do is take a nice, slow, deep breath in for 4 counts. 3, 4. Hold that. 2, 3, 4. Exhale for 4 counts. 2, 3, 4. And hold that for 4 counts. So you take a deep breath in for 4 counts, hold for 4 counts, exhale for 4 counts, and hold that. So it's like a visual spatial box that you're breathing through. Now the key is, here's my challenge for you. Before your feet hit the floor in the morning, I want you to breathe through 5 of these nice slow boxes. And then in the middle of the day, I want you to take 2 minutes. Do the same thing. Breathe through those 5 boxes. And at the end of the day, as you're laying in bed, getting ready to go to sleep, I want you to do that again. Breathe through 5 boxes. We know from studies that doing this activity for 2 weeks will dramatically change how you feel from a baseline level of anxiety and tension, and also how your body is responding from heart rate to blood pressure. So do the challenge. For the next 2 weeks, 3 times a day, I want you to do the box breathing. Breathe through 5 boxes at each time. And you will be remarkably pleased, I am sure, with how you notice a difference in feeling. So keep in mind, simple actions repeated daily are what's really going to move you to that optimal state of wellness. Do not underestimate the impact that stress can have on you, but also do not underestimate the amazing ability your body has to compensate for that and the control you have. So, you know, you've heard about the brain being the master, but your thoughts actually govern your brain. So let's make sure our thoughts are where they need to be, attending to stress like we want, and do those small daily habits to encourage your body to respond in the best possible way.